Hi, my name is Lew Lim. I'm the founder and CEO of Vielight. Today we're going to talk about a new product that we recently introduced called the Vielight Neuro, and we're into version 4. We're also going to talk about the work we're doing that eventually leads to this particular product. The aim is to make it easy for you to use, but there's quite a lot of stuff that's going on behind the scene. We'll talk about the clinical studies we're doing, the kind of research that we are doing, and how we are incorporating the latest information into something as simple as this. Joining me today are Gena and Nazanin, two members of our research team.
Yeah, I'm Gena. I'm a neuroscientist and I'm the research manager here at Vielight.
Hello, my name is Nazanin. I have a PhD in medical biophysics and I'm the director of special projects. Gena, why do you think it is important? Why the 10 hertz and the 40 hertz?
Yeah, so as a neuroscientist, that 10 hertz, that alpha frequency, it's associated with a restful state in the brain. So when you have high alpha in the brain, the mind is in a relaxed state, what you have when you're, mind-wandering, daydreaming. We see that increased 10 hertz, that increased alpha in the brain helps with things like feeling relaxed, so it helps with anxiety, helps with sleep. And then we have gamma. So gamma, you see high levels of gamma in the brain when the brain is focused, it's thinking, it's engaged in problem solving. So that 40 hertz is kind of associated with that higher level brain functioning. And so depending on what your goals are for using PBM or using Vielight, you can decide whether you want that 10 hertz, that 40 hertz, or if you want both with our duo. And also, you might want 10 hertz for the evening and 40 hertz during the day. So that's the relevance there of the 10 hertz versus 40 hertz. Just as one example, for example, in patients with Alzheimer's disease, what you see is decreased power of alpha, beta, gamma. And what we've shown in one of our studies is that using the gamma device, this was done in healthy older adults, but using that 40 hertz stimulation increased power in alpha, beta, gamma. So this is just one example of how we're learning what those brain states are and how our pulsing affects those brain states and how we can apply them to various illnesses and brain conditions.
Exactly.
Isn't this interesting? Because there was a study done in Italy on autism, and the research group used alpha and gamma on the same day, probably alpha in the morning, gamma in the evening, and the results are actually significant in improving all these measures in autism. You mentioned that high power in the slow wave, like delta theta, is sometimes not very good in particularly ADHD, where there's, it causes inattention. But we published this paper, as you mentioned, that by delivering gamma to the brain, we increase the power of the fast frequencies, which is desirable in this kind of cases, increase the amplitude of, like beta, gamma, but reducing the slow waves, delta theta, which helps with attention. But if you want to sleep, you really want the slow waves, right? So there are ways to use this in everyday lives.
So I guess we are pushing the boundaries in terms of doing the imaging with the brain and using photobiomodulation on top of that with EEG methods, with functional MRI methods, with MEG methods, or various methods of doing imaging on the brain so that we could actually capture various aspects of our brain function. So that we could improve that and feed that back for more personalization or for medical conditions or even general wellness useness of the device.
So in case people want to know what we're talking about, this is the Neuro 4, and there are LEDs here that's powered by microchips and the way we control it. There is unlikely to be too many places you can get the level of power we do it, because these LEDs are engineered only for us. So we design in such a way is, first of all, meant to be home use. it's meant to be comfortable. That's why we have it. But the other thing is to have contact with the brain.
Yes, it is very important for all the LEDs to be in contact and in touch with the scalp, because like the spacing and also the hair and everything will reduce down the effective power that we want the energy to be delivered on that location of the brain. And so it is very important for all the LEDs to be in touch with the scalp, and also it is very important for the LEDs to be designed in such a way that we deliver enough power to that location of the brain.
And that's the importance of our adjustable design as well, right? We get that form factor, we get that flush, the LEDs flush against the scalp, which is so important. And we've seen that with our research. When you don't have that good contact with the scalp, you're losing a lot of power and you're losing the effectiveness of the device.
Yeah, talk a bit, about the default mode network from a neuroscientific perspective, why we do that.
So the default mode network is very important. So first of all, the default mode network, it plays a role in things like memory consolidation, but also you see an impairment in the default mode network in a lot of brain conditions, in psychiatric illnesses, in mental illnesses, depression, anxiety, as well as addiction, for example. So we're delivering a light in a targeted way that we're targeting a very important network that becomes impaired in many brain illnesses. So it's when you're delivering that light, we already know that you want that biphasic response. You want to deliver the right dose, but you also want to deliver it to the right place, right? So, and that's what we're targeted at, I think, the right place with the default mode network.
Yeah, and so we talk about the default mode network determining where we want to place the LED, and that's been in the earlier versions of the Neuro, up to now Neuro 4. And now we've added an additional module to the cerebellum. What does that even mean?
Yeah, we actually added a fifth LED at the back of the brain, which is the cerebellum. And what we want to see is added effect or improvement in the effect. And you can talk more about that, Gena, about what is happening in the cerebellum. But from the, let's say, from the post-COVID patient population perspective, it's one of the clinical trials that we are running at the moment. What we are targeting to see those patients who have been affected with COVID virus, and then now they added post-COVID symptoms on top of that, is do we see clearing of that brain fog? That is something that we are hoping this added fifth LED will help us to enhance that, the brain fog. But you can talk more about what is going on in the brain on the cerebellum that is important for this Neuro 4 version.
Yeah, so I mean, we already had targeted the default mode network, but adding this fifth LED on the cerebellum is just enhancing the function. So we're targeting another really important region of the brain. It's involved in motor coordination, but also involved in just communication within the brain. It plays many roles. And also that fifth LED we've seen helps with glymphatic drainage, and you see that helps with a lot of brain disorders as well. So a lot of added benefit with that additional LED.
So just for better understanding for those who are listening in, glymphatic system in the brain is where there is this system of in the central nervous system that helps to clear toxins and byproducts that's not meant to be in the brain. So this flow is quite important. There are two major junctions. There may be more, but there's one actually located where we place this, on the cerebellum. And one is actually in the nasal cavity area too. So, and also there's recent published research that shows that when you pulse at 40 Hertz, you actually improve the glymphatic flow. And this is relevant to, say, Alzheimer's disease. Do you have, that study was related specifically to Alzheimer's disease. So that, we're combining quite a lot of different things into a simple product to draw, maximum outcomes, to have your brain to function better. And gamma has been related to being present in your brain when you're performing better in public, like in athletic performance in sports and stuff like that. So there's role, and alpha has been like I say, in the state where when you're restful, it's good to have the alpha there. And alpha in our research also shows that it can help to kind of help your, the structures that support brain cells, the microtubules, have to open it up and get into a transition. And if you are doing some kind of other intervention to improve brain function, like neurofeedback, alpha can actually help to prepare the brain to do something like this. And alpha can help to prepare the brain to go better into gamma state when you deliver gamma. And from our research, it's yet to be published, we know that when you deliver gamma specifically on healthy, normal people, you elevate this native gamma frequency in the brain, which leads to higher functioning.
As you mentioned, we have both the internal studies as well as many universities, academic institutions have taken interest in this in themselves and spurred their own research. So externally, one group that's doing a lot of really interesting work right now is Utah University. They've been doing a huge body of work in patients with traumatic brain injury. One's recently been published. That was done in about 43 ex-athletes with what they call repetitive head acceleration events. So it's not just about a traumatic brain injury, but with these athletes, what you see is they have these repetitive head acceleration events that may not meet the criteria or the threshold of a TBI, but it impacts the brain for sure. And so in these individuals, what they saw was that using our gamma device helped with a whole range of things: improved motor function, so grip strength, better balance, better reaction time. So this has huge implications both in the realm of TBIs, repetitive head acceleration events, but also for athletes, right? So as an athlete, I would want good reaction time, better grip strength, better balance. So this is really promising work. So that's one group, but we have many universities. Boston University has also done work in the TBI space. And then internally, we have research going. So we're just about to launch a study in patients with major depressive disorder. And we're using both the alpha and gamma to see what helps the most for these patients. So we're learning a lot. And when we use these studies and we see how it helps patients with specific conditions, while doing that, we're also learning about how the brain works and how PPM acts on the brain. So when we do these clinical studies, we also add in EEG. So we see how the light and the various pulse frequencies impact brain activity. So it's very exciting where we can see it help people, but we can also learn a little bit more about the brain as we do it.
Yeah, you touched on traumatic brain injury. This is an area where we have a lot of evidence building up, a lot of work is being done. And I think it is not just sports. We are, well, at least I'm looking into the applications in military, right? In military, you're talking about a group that's veterans that have retired from active duty, and they've come back from, just because they're in military, they could come back from tours with traumatic brain injury, long-lasting recurring symptoms. So this is an area that I think will be helpful. We have been approved by the US VA to actually treat traumatic brain injury among veterans. It's a huge issue. It's also an issue that traumatic brain injury is looked at in Canada too. Now there is another group in the military, this is active duty, where the performance can be impacted, just like the athletes, the football players, from, I would say, repetitive impact on the brain. And sometimes they're not even realizing it. because it's just, part of training. You go through, you hold this shoulder rocket launchers and this huge brain wave hit your brain. Okay, you're off a little bit and you get back into your training. Then there is simulated blast, and artillery fire and all that. All this accumulation has an effect on the brain. So we're looking into that, and we'll see what happens. But another area that we are also looking into in our clinical studies is on Alzheimer's disease, impaired brain, mild cognitive impairment, or MCI. Maybe Gena, you can mention a little bit about the work there.
Yeah, so right now we have the study. We've seen some preliminary results. We're excited for the full data set, but we're seeing improvements with the use of our device in that population. And interestingly, it's not just changes and improvements in the brain, but we're also seeing changes at the level of blood biomarkers. So the impact of PBM and how widespread it is in the body in a positive way is also very interesting, and I think there's a lot more we're learning as we go right now.
Yeah, one of the things we learned was how powerful the intranasal delivery to the brain is. The study is not complete, it's still ongoing, but what we're seeing from the early data is that the intranasal can draw the same level of activity with 9 milliwatts versus that's power density versus 150 milliwatts when delivered through, let's say, through the scalp. So it's about 15 to 20 times more efficient in activating the brain. And when you combine the intranasal with the transcranial, we actually see very, very profound, response from the brain. And this is measured in blood oxygen level dependency and cerebral blood flow. That's and those researchers really are wanting to appreciate how the brain is responding. I think this is useful information. But you mentioned about specific location. Now the early data we're seeing now is we can, and this is great. This is credit to the researchers at Baycrest Hospital. They're really experts in imaging with fMRI, MRI. They're able to start showing that actually specific areas of the brain anatomy is responding in specific ways. There's a lot to be learned. Now, the bottom line is the brain responds significantly to photobiomodulation.
So you mentioned about imaging, functional MRI imaging or EEG imaging, and what we want to see at the end of the day from collecting all these imaging information is transition and translation into medical conditions. We talked about traumatic brain injury, we talked about Alzheimer's, maybe Parkinson's. What we are doing at the moment is pushing the boundaries to make sure that these devices can become medical devices in the future. So we are doing all the testings on the product management line. We're making sure that every ISO standard is met and every individual test has been performed on safety of the device. And we would want to push the boundaries with regulatory submissions, and we would want to make these medical devices in the future so that these will be at-home medical devices that people can use for traumatic brain injuries, for Alzheimer's, for Parkinson's, for autism, for a stroke, or any upcoming condition that we could see results and benefit from photobiomodulation.
That's a really great point, Naz. So one of the great things for myself working at Vielight has been getting that research from the ground, I guess. Like we have, because it's a general wellness device, we hear from people who are using it, and then we hear that they have a condition that it's helped with. So we get that information from customers, that's that anecdotal evidence, and then we have I guess the fuel to drive forward our research and really learn how it can become a medical device for those conditions. But it's already helping so many people that we hear, right?
Yeah, our research has gone into even deeper because we're looking at the effect on living cells, on structures that are supporting neurons like the microtubules and what makes up. So this work is primarily done with University of Alberta, the group led by Jack Jaginski. Maybe you want to tell us a little bit about what we're looking at?
Yes, so microtubules or tubulins are structures abundant in the cell, especially on the cell skeleton. And what we have been experimenting, and nowadays we're experimenting neurons on top of that, or living cells, or cancer cells, or different types of, let's say, petri dish structural mechanisms, is that using photobiomodulation and using different frequencies of light, what we see is that those structural or living cells react differently. So let's say at 10 hertz, Lou touched on the 10 hertz frequency. That is, it seems to be a transitional frequency. So what is happening with polymerization or depolymerization of these structural elements is different from that of 40 hertz, and it's different from that of 120 hertz. So frequency is very much important for this research and at this moment. And we are actually finding much, much more. So we have a couple of published papers with this collaboration at the University of Alberta. We have some upcoming information being published soon on that.
Yeah, what we're learning now is different frequencies have different effects. It is a synthesis of different functions in the brain. And I say that, so we got customer surveys, we have research, we have marketing to disseminate the information to everybody so that they know what we're doing. And I think our engineering team is pretty incredible. We are doing stuff. The reason why we're always at the cutting edge is because we're always innovating, experimenting, how to do things better, how to do things more effectively. I often come up with the ideas. I think we own the largest portfolio of patents in the industry. And I say I'm usually the one that's inventing and coming up with new ideas. Now the patents are all owned by the company. So we are innovative. I think we are at the cutting edge in many areas to put things together. And our collaborators, we are working with some of the smartest people around, some of the elite universities. And there's more to come. There's more news that's coming out of who we are collaborating with in clinical studies. I think researchers who work with us should have comfort that we are always looking at basing everything on evidence. There's nothing that we have here that came out randomly. Everything is thought of, tested all the time, putting through regulatory, the kind of safety testing that we have to go through to be a medical device, and we are fully certified, ISO 13485, certifying us as medical device manufacturing. So we try to put everything as much as possible in place. So I guess that's like not only we want to make sure that we are totally based on evidence, but we're always in search of what's the latest. It's not coming out totally from us and our collaborators. It's coming out from news sources, coming out from other universities. So our ears always on the ground, to try to incorporate the latest.
Yeah, photobiomodulation community is working, and all of us are working hand in hand to push this spectrum of knowledge to the front. Yeah.
Do you have anything else to add, and we can summarize?
So I think what we covered is with photobiomodulation devices, specifically the Neuro Duo 4 that we talked today, we have a great means to make some interesting impact on people's life. This is an at-home device, so everyone can use it very easily under comfort, watching TV or whichever way they want. But they have the calm that we do have enough evidence for designing this device. And we've also tested this device thoroughly so that everyone worked together, and the neuro duo is in your hands.
I'm just excited for what we're doing from the neuroscience field. I mean, this is designing a device that can impact the brain, and brain health is, we know the importance of brain health, and so I'm just excited for the work we're doing. And as we optimize this device, we're also, I think, doing some groundbreaking work in neuroscience in general and uncovering the mysteries of the brain. So it's exciting.